Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm ASHLEIGH, MESSERVY. It's Medical Monday here at East Cooper Medical Center, and today we're sitting down with a vascular surgeon to learn about treatment options for those suffering from abdominal aortic aneurysms.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Jeffrey RUBIN. He is a vascular surgeon here at East Cooper Medical Center. Thanks for being with us today.
Well, thanks for having me.
Okay, so today we're talking about abdominal aortic aneurysms. Let's start off with, what is that?
An abdominal aortic aneurysm is a ballooning out of the artery in your belly.
Okay.
So if you imagine a balloon, blowing it up, an aneurysm starts small and they can get larger, and if they get too large, they pop.
Okay, so how fast could that happen? I mean, does it vary?
It varies. They can happen, they can dilate quickly, or they may take many years to dilate.
Okay, so who is at risk with when it comes to this?
The risk factors for an aneurysm are people whose relatives have had an aneurysm. That's the most common. It's older people, usually over 55, and I probably should temper the word older, but older patients who have arterial sclerosis, high blood pressure, cigarette smoking. Basically, those are the key factors.
So talk about the importance of knowing your family history when it comes to things like that. Is it really important to have that background?
Yes, because we know that the aneurysms are passed down in the X chromosome, and we've identified the 16th chromosome as being the key chromosome involved. So if you have a family history, especially on the mother's side, they're passed down. So siblings can have them, first cousins can have them. It's important to know.
Okay, and so what are some of the symptoms? Do you start feeling a certain way, or?
Most of the time, aneurysms are picked up in asymptomatic patients. May not know it. A lot of us in America are a little on the heavy side, so you may not see the pulsation in your belly, may not feel it. And so in the past, most of the aneurysms have been picked up on examinations done for other things, like if someone comes in with kidney stones. An x-ray is done, they'll see the aneurysm there. You can see the aneurysm on plain x-rays, but we find them much more commonly on ultrasound and CAT scans.
Okay, what are some of the treatment options available? I mean, is losing weight something that could help, or is that not, it's not that simple?
No, unfortunately, we haven't found any medical changes in your life that will stop the aneurysm from growing. The aneurysms just have a mind of their own. We watch them, so if we know someone has an aneurysm, we'll watch it if it's small. Sometimes they won't grow, or if someone's older, they may have other comorbidities that can influence the growth of the aneurysm. We know that if you have other major operations, that can cause the aneurysm to grow quickly.
So does that mean that in certain situations, though, it does require surgery? Is that a pretty invasive surgery?
Well, it used to be.
Okay.
We used to make an incision down the middle of the belly from the bottom of the ribs to the top of the pubis, and go all the way back in to the back of the belly and replace the aorta with a graft. We have new technology. It's not even new anymore. We started in the 1990s, where we can use what we call a covered stent. So it's a metal mesh work like the old Chinese finger traps, and it's covered with a fabric, usually PTFE or Gore-Tex, things like that.
Oh, wow.
And we can place that graft through puncture holes in the groin or very small incisions, about an inch wide.
Isn't that crazy how much it's evolved over the years?
Yeah, when we started the new technology back in the 90s, maybe 1 out of 10 or 2 out of 10 would qualify for the graft, the new technique. But as things have improved and the grafts have improved and the access has improved, now 80%, 90% qualify.
And I'm sure that probably helps with the recovery process as well, right?
Well, the recovery process for an old-fashioned aneurysm repair is 5 to 6 days in the hospital, 6 weeks of no lifting, major operation. With the new techniques of doing this operation, people go home the next morning, just overnight stay.
All right, so anything else the folks at home need to know about when it comes to this? Like what to look out for, a pulsing in their belly, right?
If you're lying on your back in bed watching TV one night and you see the sheets moving, that's a good sign you probably have an aneurysm.
Oh, wow.
If you're thin, you can feel the aneurysm pulsating, then you go get checked. And the physicians on physical exam, they should take the family history, and quite often a physician can feel an aneurysm where a patient or a family member couldn't.
Gotcha. All right, well, Dr. Rubin, thanks again for being here with us. And for more information, head online to eastcoopermedctr.com.